Fear of falling is a leading risk factor in elderly falls. People who are frail and those who have fallen once already are the most likely to be afraid of falling. Encouraging fallers to keep active can break the cycle and restore confidence. Caregivers should encourage even frail older adults to exercise and plan programs to accommodate all levels of ability. Exercise therapy can help older people restore muscle strength and flexibility, as well as improve their quality of life. Side effects from medications are a major cause of falls among older people. Medications often affect balance.
Some of the problems I had while they were adjusting the amount I take of this was that I was kind of wobbly and kind of woozy, and didn't seem to have the equilibrium that I should have.
Caregivers should review medications with a doctor or ask a pharmacist to evaluate potential side effects. When people are old and frail, even moderate amounts of alcohol can affect their balance, coordination, and judgment. Injuries often involve bumping into furniture or falling downstairs. Caregivers should be sure the patient is not combining alcohol with medications with warning labels. Falls are often a warning sign that an acute illness is developing and indicate an underlying condition that needs to be evaluated by a doctor. Heart problems, inner ear disorders, and other peripheral vascular diseases affect balance and increase the risk of falling. Parkinson's disease is often associated with falls. Foot problems are a cause of instability and falls. Diabetes, a common disease of older people, often causes nerve damage to the feet, which interferes with the ability to feel where their legs are. Any fall should be followed up with a visit to the doctor to investigate possible underlying disease. Dementia is a major risk factor for falling. For people with reduced cognitive abilities, it is important to keep the environment free of hazards and to provide assistance when it is needed. Caregivers may also need to use protective devices to prevent falling out of a chair or bed. Stairs are frequently involved in falls, resulting in serious injuries. Use safe techniques when climbing the steps, such as lifting one foot at a time and holding on to the rail. To prevent falls, install handrails on both sides of the stairway and keep the stairs clear. Good lighting is essential in preventing falls. Too much light can produce a glare. Shadows also interfere with vision. Not enough light is the most common type of lighting problem. Be sure all stairs are well lit and that there are light switches at the top and bottom of stairways. Good footwear is important in preventing falls. Older people should wear properly fitted shoes that have firm, non-skid, non-friction soles. They should sit down while putting on shoes, or stand next to a counter or bureau while dressing, so there is something to hold on to. Wet and slippery surfaces contribute to many falls. Bathtubs are hazardous, but a non-skid mat reduces the chance of a fall. Caregivers should be sure that grab bars and a bath mat are handy when older people get out of the tub. Handicapped toilets with grab bars also reduce the risk of falling. Icy sidewalks in the winter are especially dangerous. Caregivers should encourage older people to stay inside when the weather is bad. Curbs and doorways are often involved in tripping falls. Tripping happens when the person is unable to lift his foot high enough to clear the obstacle.
Breakfast is ready.
People often trip when they walk between a carpeted area to a floor. Strength training designed to improve the ability to lift the feet high enough to clear an obstacle can reduce the chance of tripping. Elderly people should always do exercises that improve their ability to lift their feet. Chairs, beds, and cars are all things people get in and out of, and are frequently involved in falls.
Ready? It's locked.
Over half of the accidents in nursing facilities involve getting in and out of a wheelchair or a bed.
Towards me. Come towards me. Okay. Now turn. Back to the bed.
Be sure the lock is on before getting someone in or out of a wheelchair. Unstable furniture, especially furniture on wheels, is involved in many falls. To prevent injuries, keep safety brakes on hospital beds.
Before you get up.
Keep small, unstable pieces of furniture next to the walls. Encourage people to use a walker or cane for support, rather than holding on to the furniture. And teach them how to use these devices correctly.
The walker should be flat on all four legs before the person steps.